V600E is the dominant V600 mutation. However, depending on where you are in the world, up to 5 to 30% of V600 mutations can be K, and a few percentage can be others, V600R, V600D. BRAF targeted therapy is approved for patients with V600E and V600K because that's the dominant V600 mutations, and there's substantial data on randomized trials suggesting that these drugs are beneficial in those populations. There's some case reports suggesting that patients with other V600 mutations may also have benefit from BRAF targeted therapy, but there's no randomized data in those populations. Interestingly, V600E mutations tend to be more common in younger people and in women and in tumors that are on the trunk. V600K mutations are more common in older people and in men and in melanomas that are on sun-exposed areas. And when you look at it, it appears that V600K mutations are associated with sun exposure in more lifetime sun exposure. V600E mutations are associated with that kind of really intense burns as a child, but then not chronic sun exposure. And as you might imagine, based on that, the percentage of V600K is higher as you go closer to the equator or if you're in Australia. So at MD Anderson and their series in Houston, they have higher rates of V600K mutations than we do in Boston, for example. And in Australia, very similarly, they have a very high rate of V600K mutations just because of the chronic sun damage and the UV irradiation that's probably associated with driving that type of mutation.